I just want to say that I fully agree with what Dr. Mohanty said, that this is not a question of rural versus urban. I don't think that anybody in this room would argue that it should be rural versus urban. I think a lot of what has been said is that there is probably rural in the urban and there is urban in the rural, and we need to figure out what our conceptual language would be to think about that. And I think that's the mandate I take from all the speakers who have spoken until now. I just want to make a quick invocation to the two big names that we've been thinking about since morning. I first read S.C. Dubey's book in Telugu, and it came to me from a journalist who works in a village about 30 kilometers from here, in an area where there is another lake called Edulabad Lake, which is downstream of Shamirpet Lake. And this journalist brought that Telugu translation of S.C. Dubey's book and said that this book should be read by all PhD students in the university, and they should be using it to study villages now in Hyderabad, because there's a need to really go back to these villages and see what's going on. And I found that very touching, because one of the things that we keep constantly struggling with in our own work is to try and find some place, some text, something that gives us a starting point where somebody has already studied, so that you can go back to it, and it's an important part of our work. I also want to say that 1950s is a very fascinating period in social sciences, particularly in anthropology, which is the time when a group of African anthropologists organized under the Manchester School of Anthropology did a lot of studies which actually challenged the Chicago School of Urban Sociology. It was very, very fascinating work which has been completely forgotten over the next 2 or 3 decades, 4 decades, and revived only in the last 15 or 20 years. And it's made a lot of difference to the way in which we study cities. I wanted to also invoke Tarlok Singh ji, because I actually worked with a senior civil servant who was a kind of mentor to me at some point. And he used to teach me how to make agendas for committee meetings. And he said, my mentor always taught me that the 8th point in the agenda should be any other matter that is of importance. And you should know that very often it just so happens that that's the one that everybody will pick up and talk. So, often in conferences we kind of try to figure out what is the substance of what we want to talk about, and it seems to be going all over the place. I'm saying all of this because I think I've been feeling a bit uneasy about the term emergent issues or emerging issues. Rural-urban linkages since 80s, poverty for the last 50, 60 years. I don't think any of the issues that has been talked about today is an issue that has just come up today. It's been around for a long time. The question is, what are the languages, what are the conceptual apparatuses, what are the new framings in which we can think about them, and how do we revisit the ways in which we have thought about these issues in the past? So let me just give one example of the rural-urban linkages and rural-urban connections. I attend a number of conferences, usually where economists are making presentations, and rural-urban continuum is almost always talked about in terms of migration. And I find that very strange. As a geographer, one of the ways in which my discipline teaches me, the core tenets of my discipline teach me that you ask the first question, where? You ask the next question, why here and why not there? Right? So where is the exact location of this rural-urban continuum? Is it in the urban fringe, which is where the limits of the statutory town end, and you see a whole lot of rural area outside of it, which is being taken over by the city? What is happening there? Is that the rural-urban continuum? You have a lot of land categories inside the statutory limits of the city itself. Hyderabad has a large number of water bodies whose survey records are all rural. They come from an agrarian background, and they actually act as a great source of friction and also a great source of opportunities for land markets in the city. That's rural-urban continuum, because it has consequences for caste, it has consequences for occupations, it has consequences for very serious, very powerful social organizations. I mean, in every corner of Hyderabad city, we find caste associations of occupational groups emerging after cost occupations have disappeared. Fishing has become impossible in local water bodies, and you have fishermen's associations being formed. And they're becoming players in the urban land markets, right? And I think these are issues about urbanization that we just don't seem to be thinking at all about. What that then means to me is that there are a number of issues which are emerging in the sense that they are knocking on our doors. They're asking us to reformulate our language, and we are not paying attention. There was a lot of talk this morning about whether the voice of the poor can be heard or not, what can give the voice to the poor. I don't think the problem is with their voice. I think the problem is with our auditory apparatus. Right? We just don't have the auditory apparatus to listen to what's being said by people. So how do we organize the various issues that have come up this morning? In my own mind, micro-enterprises, informality, labor, and land and capital circulation. Unless we think all of these things together and see their spatial manifestations, whether it is in the rural or in the urban, we will not have a common framework. If we want to think about the rural and the urban together, we need a common framework in which we can think about that. And I think the issue is that when we talk about, somebody was saying this morning about how when we talk about informality, we only talk about labor, and we want to move away from that. One of the biggest sources of informality in cities is land. Land records, land ownership, land title. And the informality in land is a thing that has actually enabled huge and extremely diverse urban economies, and we just have no sense of it. All of our apartments that people are buying here are priced at a certain particular level precisely because of the informalities in the land records, in the way in which those transactions can take place. Those prices are set because of that informality. You have people operating on the street as hawkers and vendors and so on and so forth because they have informal opportunities and informal arrangements with people who are in power. People find housing in cities because of the informality in land categories and land transactions. I have seen people transacting in land without any registration, without actually entering any of the government records, using a document which in Hyderabad is commonly referred to as a no-entry document, and it's a very beautiful evocation. It's called no entry because in their minds they think that it means that nobody can enter that piece of land once they sign that document. But actually it's just a notarized document. What they are doing is to transfer general power of attorney to somebody else. Now, if we have land as one of the key sources of informality, how is that informality then shaping the way in which informalities in labor organization, in the way in which they enter into contractual arrangements, then which are then driven by local customs and moral codes of conduct? How do we track these things? And if we don't track them, how do we then talk about micro enterprises, which are supposed to be a very, very large percentage of our economy, each of which employs on an average of 2.5 people? In our startup culture, hypermasculine startup culture, we call it the 2 men and a dog operation. It's a 2 men and a dog operation, which is basically an operation in which you have just two people and maybe, one more person who's kind of coming in and operating and going away. But this is what your pawn shops are. This is what your hawkers are. This is what your machine tooling shop is. This is what the huge amount of manufacturing that has come up in all the industrial areas around Hyderabad city. Go to pharmaceutical industry in Patancheru, go to the ECIL electronics area, go to Kukatpalli, Kutbulapur, go to Katadan area. All of these industrial estates are basically 2, 5, 6 people. And they have all emerged on the fringes of the public sector. They have taken skills from there, they have taken materials from there, and they have also brought all of that back into those industries. So I think that thinking about micro enterprises, the way money comes into it, the way labor comes into it, the way it travels through the city and outside the city and into all of these smaller towns. That's really, really important if we have to do anything at all about figuring out how to make this distributed manufacturing that serves the rising demand in the small and medium towns can be figured out. If we need to do that, this is the work that needs to be done. The second set of issues that I think are very, very important is in many of the conferences that I attend, people make large projections, people make very large claims. I mean, we just heard about 5 million crores, 2 million crores, 3 million crores. Where do these numbers come from? When we look at the actual basis of these numbers, apart from the projections, apart from the problems with the modeling and so on and so forth, almost every one of the people who make those presentations say that, but you know, this data itself is very problematic, but we still need something in our hands to make these claims. If we cannot make those claims, how do we make policy? And I find that very, very intriguing because in the last 10 or 15 years, one of the things that I have done is to do a sort of on-the-fly ethnography of how governments work. And one of the one of the professionals that I've been very, very interested in is planners. Right? The 2020 master plan of Hyderabad city, which was released in 2006, has a very intriguing paragraph in it, which says that in the last 10 or 15 years, land that was originally reserved for storage of food grains had to be given for an institute of fashion technology. The world has changed so dramatically, so radically, that we don't quite know how to operate. This lack of confidence in the data that you have is not just in Hyderabad, is not just in any Indian city. I interviewed the chief planner of Shenzhen city in 2010, and he told me that the city grew from 2 million to 20 million in 10 years. And I asked him, how did you plan for this? How do you plan for this? He said, you know, we make this huge projection, we multiply it by 4 times, and then we know that we're going to go wrong. That's how we're going to do it, right? Which basically means that you're kind of putting on a sense of confidence, you're projecting that confidence, but you're taking a huge gamble. And you need to take that gamble, you need to project that sense of confidence and so on and so forth, but that's the nature of the job. If that's the state of affairs, I think that there has to be a substantial amount of investment of intellectual energy in trying to figure out where do these numbers come from, how are they constructed, what are the basis of these numbers? Because they seem to be coming from the need for making calculations, and calculations can be extremely tyrannical, right? I mean, you need to move towards a project, and therefore the logic of that itself produces the numbers for you, and we need to know what those forces are. If we know them, then we can possibly harness some of the forces to make things work for us. Otherwise, we plan huge infrastructure projects, and the costs of delay are double, triple, and we don't know what to do with it. I mean, I don't even understand how a project whose costs have escalated to 3 times, 4 times, with private partnership, how are these private companies even managing? How are they being able to answer their shareholders? Right? So something is really weird is going on which we can't quite figure out. I think that it's really important for us to invest energy intellectually into understanding where do these numbers come from, what are the dynamics, how do they construct them, so on and so forth, so that we can have some kind of a sense of control over what needs to be done. So I'll stop there. Thanks.
Cities are considered places of economic efficiency, and I think this idea has been already said many times. And economic efficiency is linked again with human capital. There's a physical capital and there's a human capital. I think we have not talked about that human capital which exists in the city, which are creative, which are innovative. And this is the human capital component. But again, if we look at the conditions in which we are, the kind of quality of urbanization we have, do we have that kind of creative human capital or not? Like in the morning, Mr. Radhakrishnan started with index of happiness. And I was looking at I found that very clearly it emerged the health and education component were the worst in Indian context. If you look any index, that we are at the bottom. And now if urbanization is going to give us a direction or is a major driving force of economic efficiency, so we can't ignore that component. That's my a kind of a challenge to urban experts, that how we integrate this health dimension or education dimension into the economic efficiency of the place. So with that premise, I need not to say much about the contemporary urbanization and so on, which has been said. But what I find that there are two transitions going simultaneously. One is the demographic transition. We are switching from rural to urban, and urban transition rather, because we are urbanizing, or whether urbanism or urbanizing. And the second one, parallel with that, is epidemiological transition. I will explain these two, how these are related with each other. This is what I'm trying to explore, that is there any relationship between the two of the demographic shift which is happening and then the disease pattern which is shifting. What we find that the urban areas, I call them areas of urban penalty, that there are opportunities, but at the same time there are urban penalties which are related to infrastructure, climate change, housing, social institutions, etc. I mean, all these are well said, that, so I call them urban penalty. Second thing we find in the urban context, again, these will be linked with the health, inequities and inequalities. There's a social justice concept, although we talk about poverty, but in health we'll find that that's a very serious health inequity issue binding. Then there is a very complexity of health transitions. It's not that simple that we switch over from communicable diseases to non-communicable diseases, or one type of health system to another kind of health system, or pharmaceutical industry to Ayurvedic industry. So there are very complex transitions which are happening simultaneously. It's not that easy to understand. So at the same time, we find that the health budget allocation is very low. It's almost 1% of the GDP. If you compare China, for example, we repeatedly give example of China, our friends are sitting there, it's about 6%. 6% of the GDP is towards health. And that's why if you look any health indicators, whether urban or rural, the only problem today in China is the air pollution. But otherwise, the other indicators of health are far better or closer to any developed country of the world without having that much of GDP, because they have given concern to health. And that's why I think the productivity of the Chinese worker, if you look again, the economic efficiency factor is much higher than Indian worker, because most of the time the Indian worker is sick, is absent, and indebted with the health issues. So that way, the productivity is very, very serious concern. Now, I look at the two dynamics. The demographic dynamics, where does it come into health? I call it urban social demography of health risk. That what we find that the elderly population in the cities is rising, on the rise. Although we talk about this, and it was 4.7% in 1961, which has become 7.5% in 2011, and going to be around 11% by 2021. So this group requires a special attention, and not a simple communicable disease, rather a non-communicable disease, cancers and cardiac and so on, which are highly capital-intensive kind of treatment. So that way, this demographic transition is very important to understand that what our elderly population is growing. Second is in the middle, the young population group, which we call the demographic dividend. I call it sometimes demographic penalty as well, because most of these young people, if you look into the workplaces, they are under stress. If you consider the hypertension, diabetes, the maximum these cases are under this particular group. And these are the area that in which urban condition they are living, and they are producing this kind of new health challenges. So I think we have to understand this kind of vulnerability of this particular group, these two age groups which are changing very fast. Then we look at the urban epidemiological transition. Earlier, being a developing country and water, sanitation, you can say drawbacks, and urban poverty and poor, their exposure to water-related disease was much higher. And our health system was responding to the communicable diseases. But now what we find that the share of communicable diseases in the total disease burden is on the decline. And non-communicable diseases share has crossed 50%, which is almost equivalent to any developed country of the world, where, I mean, most of the non-communicable diseases were related with richness or you can say wealth, because cardiovascular disease or diabetes and hypertension were earlier related with this group. But we are suffering, we are coming with that. And these, you can say, another concern with that is the air pollution, which we know now is the major contributor in the cities. And we have seen in Delhi, the urban smog and so on, and the, you can say, lung diseases on the rise, etc. Likewise, accident and injuries in India, in urban India, is the third leading cause of death and injuries. So because our roads are not safe. So what I'm saying is that the whole spectrum of the communicable diseases or disease pattern is shifting towards these, and which I say are the most expensive, 10 times or 15 times expensive to treat. So again, this phenomena is not limited to the rich people or a middle income group. But we find that non-communicable disease, I have looked at the NSSO data of 60th round and 71st round social consumption health survey. And very clearly it establishes that the disease pattern is shifting towards this. And the out-of-pocket expenses and hospitalization cost are skyrocketing because the private sector is providing most of the health care here. 75% of the total, you can say, ailments are being treated by the private sector, not the government or the health public sector, because there's no confidence into that. So I think that, again, is a very kind of